Today, we're diving into one of the most challenging situations you can find in a hospital, a true high-wire act where two lives are on the line, and every single choice matters.
So just picture this for a second. A patient is pregnant, but her heart is in trouble and she needs surgery, like right now. The doctors are facing this incredible dilemma. How do you save the mother's life without risking the life of her unborn child? The stakes just don't get any higher.
For the longest time, doctors were navigating this in a bit of a gray area, working with pretty limited data. But that's all changing. A huge 40-year review from the Mayo Clinic is finally shining a bright light on this, giving families and doctors the kind of clear answers they've desperately needed. So let's get into what they found.
Okay, so first things first. Why is this question more critical now than ever before? Well, it all starts with just how demanding pregnancy is on the body.
I've heard it said that pregnancy is the ultimate stress test for the heart, and it's so true. The changes a body goes through to grow a new life are just massive, putting so much strain on the cardiovascular system. If your heart is healthy, it's a marathon. But if it's already compromised, it can quickly become a crisis.
And here's the really crucial backdrop. Heart disease is already a top cause of death for new moms. Add to that, modern medicine is so good that more people born with heart conditions are now living long enough to want to start their own families. And we're also seeing a rise in acquired heart disease. So you have all these trends coming together at once, making these super high-risk pregnancies more and more common.
Which brings us right to this study itself. This incredible deep dive into the data that is completely changing the game. The researchers didn't just take a quick snapshot. We're talking about 40 years of data to get to the real answers.
And get this, over that entire 4-decade span, they found only 29 cases. That number alone tells you exactly how rare and incredibly complex these situations are.
And this part is absolutely key. All of this information came from just one place, the Mayo Clinic. Having that consistency from a single, expert center means the findings are so much more powerful and reliable.
So, what did all this data actually show? Well, it tells a really tough, fascinating story. It's a tale of two patients with two very different outcomes.
And this is the heart of the dilemma. For the mother, the surgery is actually incredibly safe. Her mortality rate is only 3%, which is about the same as for someone who isn't pregnant. But for the baby, it's a whole different story. A 17% mortality rate, that's a really significant risk, and it shows you exactly where the danger lies.
As Dr. Katie Young, a cardiologist on the team, points out, this high risk to the fetus doesn't go away, even at a world-class hospital. That tells you this isn't about how good the surgeons are, it's about the fundamental biological challenge of this specific situation.
But here's the amazing part. The study didn't just identify the problem, it uncovered the single biggest factor in solving it. And it all boils down to one simple thing: timing.
The difference timing makes is just incredible. Look at this. When the baby was delivered after the mother's heart surgery, the fetal mortality rate was a staggering 29%. But now look at the other bar. If the baby was delivered before the surgery, that rate gets cut by more than half, dropping all the way down to 14%.
Dr. Elizabeth Stevens, a surgeon from the study, lays it out plain and simple. The data sends a clear message. Whenever it's medically possible, deliver the baby first, stabilize the mother, and then go in for the heart surgery. That one change in the sequence of events can make all the difference in the world.
Now, a finding this big doesn't just stay in a medical journal. It's actively changing the way doctors are planning for and managing these high-risk pregnancies right from the very beginning.
The authors have laid out a whole new playbook. It starts even before pregnancy, with preconception counseling. Then it's about building a specialized team of both heart and pregnancy experts, a cardio-obstetrics team. And for the most at-risk patients, it means being at a top-level hospital that has the experience to handle anything.
So the big takeaway here is pretty clear. It all comes down to proactive, specialized planning. Instead of reacting to a crisis, the goal is to get way ahead of it. That's how you give both mom and baby the absolute best shot at a healthy future.
So where do we go from here? This study is a huge piece of the puzzle, but the work is definitely not done.
This research is a massive leap forward, but it also opens up an even bigger question, doesn't it? As medical science gets better and better, we're saving more people with complex conditions who then want to live full lives and have children. And that means we're going to keep facing these kinds of challenges. So the real question becomes, how do we keep learning and innovating to protect not just the patients in front of us today, but the generations of tomorrow?